everyone. So today we have with us Dr.Aagam Shah. Sir has done his MBBS from Government Medical College, Bhavnagar. Sir is an MD in Pulmonary Medicine. Currently, he is working as a senior resident at Delhi Center for Respiratory Diseases. A very warm welcome, sir. Sir, would you like to give us a brief introduction about the branch Pulmonary Medicine? So we would be highly grateful.
Sure. First of all, I would like to thank Dheerya Boghani and your entire KYC team for hosting such awesome sessions for the budding doctors for. So, yeah. Now about the respiratory medicine branch. First, I would like to break the myth that it is not just about tuberculosis. When I had to take the branch, I had some opinions of some of my colleagues, some of my friends, some of my relatives that the branch is just about tuberculosis. The first thing I want to tell is it's not just about tuberculosis, it's much more than that. So respiratory medicine being a super specialty branch, it includes 5 things. So it's the first is the core pulmonology, second is the critical care medicine, third is interventional pulmonology, fourth is the allergy medicines, that is the allergy diseases, and fifth is the sleep medicine. So this entire things builds up the entire respiratory medicine. It's not just about one thing or the another. So it's a huge thing and it's a very big branch altogether. But I feel that it is a very underrated branch in the present scenario. It is definitely a 3-year super specialty branch, but some way or the other people are very prejudiced to take it. So yeah, it is being in this field since last 4 years, I really believe that it is a very good branch to proceed with.
Thank you, sir. Sir, now we would like to know about your life as a resident doctor. Was it too hectic? Did you get free time? Please share, sir.
So the entire residency 3 years put a total roller coaster ride. In my first year of residency, we had hectic schedules in the wards, in the ICUs, in the emergencies. So our first year was totally about that. But I feel that first year is very important to build the basics. Once your basics are strong, you can definitely build the entire journey and go on with the process quite easily. But yeah, first year is quite hectic. You hardly get time for yourself, you hardly get time to sleep. But after the first year, when you know about the branch, when you know about the basics, you really feel that it was definitely the worth it. So first year was totally about that. In the second year, in the initial second year, we were caught up with COVID. So 1 to 1.5 year we were totally caught in COVID. But COVID basically affecting the lungs. So we had also a lot to learn in the ICUs, in the wards about the patient, and we have done a lot of work during this time. So and also after the second wave, we started reading and started applying things to the patients. So you read articles, you read books, and started applying and treating the patient in a similar way with different diagnosis and treatment. So the entire journey was quite good. We had learned a lot about the ICU setups, about the ventilators, about the OPD part. We had just one unit in a setup, so we had daily emergencies. So we had a lot of patients to deal with. We have variety of procedures daily: ICD insertion, pleural tapping, bronchoscopies, thoracoscopy. A lot of procedures we were given hands-on. So and in the third year, along with the procedures, we had to read for the exams and dissertations. So overall the journey was quite good, and after the 3 years it was definitely worth it. After learning the basics, it is very good to do and work as a pulmonologist.
So, what are the things that you love about being in pulmonary medicine? So, I'm sure people would want to know about this. So, your views.
Basically, it is. I have three to four things to say about this. So first of all, it is not a dependent branch. I can individually develop my own setup, a small setup initially, and then to go with. Secondly, it is we can get a lot of procedures apart from any other physician. We had a lot of intervention in these fields like thoracoscopies and bronchoscopies, and the naturally advancing procedures like endobronchial ultrasounds, robotic surgeries, and navigation bronchoscopies. Thirdly, it is a end branch and subspecialty super specialty branch. So in the 3 years you are a super specialist as compared to the other fields. So I was passionate about medicine, but I was not passionate about taking a particular field. But I didn't wanted to study for DM or a study for a long period of time. So this was a shortcut branch and a super specialty branch itself. So I decided to go with it. And also thing is you get satisfaction to treat respiratory patients in a very corrected way. But yeah, apart from that, a physician treats in a very simple way. A respiratory physician goes to the core of the disease and treats it in a well-mannered way. And it has a lot of follow-up patients and also treats in a very good manner. So you get a satisfaction of particularly a single branch. So I believe that it is a very good branch to pursue in the long run.
Now, exactly the opposite, sir. Sir, are there any cons according to you in the branch pulmonary medicine?
Yeah. So from my end, I think that one con is the branch is quite infectious. So I think that the persons who have very low immunity or who are that they might get an early infection should not proceed with this branch, because you have to deal with a variety of patient and you are at the risk of droplet infections, airborne infections. So I think this is a major part. Apart from this, I don't think there is any point in taking this branch.
Now, that was very informative and very, very important, sir, for before choosing this branch. Thank you so much, sir, for this. Sir, now according to you, is there any particular personality that one must have in order to choose pulmonary medicine as their career option, because it is going to
Yeah.
stay with
I
them
would like to say
lifelong?
that don't choose respiratory medicine just because you want to pursue medicine. Do it by a choice. Or suppose there are people who just want to do cardiology or any other neurology or something, so they should proceed with medicine and they are passionate about a particular field like gastroenterology or endocrinology. But if you are passionate about respiratory medicine or you love that branch, so definitely go for it. Secondly, you should be passionate about the branch and you should be quite ambitious to take in the long run. And one more thing, that you are stuck to one branch, like you will get more of a respiratory patients only rather than cardiac or any other patients. So I think that if you can deal with just one variety of patients, then you should definitely go for this branch.
Now, sir, according to you, the kind of people who should not be choosing pulmonary as their branch in future, sir?
Yeah, just I told that it is highly infection. If you fear that you'll get infection, so yeah, that's the major point I think. Baki, yeah, you can take it definitely, because but you have to work hard. You have to stay dedicated. It is not a short-term game that you just have to work for particular hours. You have to be dedicated and passionate about this.
Now, sir, according to you, after finishing pulmonary medicine MD, so how many average number of years does a person take to settle down? Also, sir, what are the aspects of settling down in a small city versus a big city or maybe a town? So, we would like to know this from your side.
Okay. Yeah, I would like to divide this in three parts. After MD pulmonary medicine, you can either choose a government setup, either you can choose a private multi-speciality hospital, or either you can do your own setup. So I'll start with the government thing. So after 3 years of medicine, you can join as a senior resident in some government institute. So being a senior resident, you will mostly have 9 to 5 fixed job and a fixed salary, and then accordingly you can apply for assistant professor and associate professor in a government setup with a fixed amount of salary and a fixed amount of work-life balance. So in government setup, you will just have to work for 9 to 5 in the long run. Secondly, in a private institute, so when you join a multi-speciality hospital, initially you will get days you have to work hard to build your name, and eventually in the long run you can develop your private setup, or you can be with it, and it is good for definitely monetary aspects, and also you can do it by your name, and you can do it well in the long run. And in the private setup, I believe that in the initial stages it will be very difficult, because in the private sector you need initially a lot of investments, lot of expertise and lot of materials to build a private setup, and I don't think that in the 5 to 10 years you can get easily the return on investment. So after you are a brand, after you get the name, you can leverage that, and you can do a private setup. And one more point, that you be in a tier 1 city or tier 2 city. So I believe that it is a subjective matter. First of all, I talk about tier 1 cities. In tier 1 cities, it is a slight difficult to get jobs. You are underpaid as compared to your peers, because as a fresher you will be underpaid. But if you believe that you want a good quality of life and a good setup in the long run, you can definitely need to settle for tier 1. But if you think about the monetary aspects, so I'll recommend you to try tier 2 or tier 3 cities, because you are paid well, but your growth will be stagnant. You can't grow from a particular point. But in tier 1 city, you have opportunities, you have very conferences, you have workshops, you have variety of things to grow. But tier 2 city, you will get money, you will get everything, but you won't have a growth better than a point. So yeah, these are my views, but best person can be subjective. It may have, not have their own views also.
Now a burning question, sir. How much do people earn after doing their MD in pulmonary medicine? Basic idea about the monetary aspects of this branch, sir. I'm sure people would want to make a informed decision about this as well. So please guide us.
So starting with the government setup, a government setup, you will earn up to, when you become an assistant professor, you will earn up to like 1.25 lakhs to 1.5 lakhs. In the long run, like when you become associate and HOD, like it's a very long journey, and gradually your salary increases, but it will be a fixed salary. So if you are a person that who wants a stable job, type B personality, that you are happy with just a little chunk of money, then you should go for like government setup. Secondly, in a private multi-speciality hospital, when you join a private setup, so I think that also initially you are underpaid, but when you gain an experience of like 5 to 7 years, you can build your own setup, and you can earn from zero to infinity, because in the private setup, sky is the limit. So yeah, this is my view, that but also you can join some multi-speciality hospital, you can stay there, but also in tier 1 cities it is possible, but also your job will be you can get increments every year, but you will be a stable job. But apart from that, private institute, when you start up after like 5 to 10 years of experience, you can earn from zero to infinity for sure. So it is dependent on the subjective choices. And also, if you are planning to go abroad, it is a very good opportunity for respiratory physicians. Like right after COVID, there is a lot of demand even overseas. So also recommend that if you don't get a chance here, or if you want to pursue overseas, you can definitely try for it.
Sir, now after finishing your MD in pulmonary medicine, sir, any improvement in the amount of free time that you get? Sir, are you able to follow your hobbies and passions? So, free time now versus the amount of free time that you might have gotten during your residency days. Sir,
Yeah.
any improvement in
So
that,
when I was
sir?
a
So,
resident,
please.
obviously in the first year we don't get much time, but in the second year, in the final year, we used to get time after 5 to 6 o'clock. Around we used to get 2 to 3 hours for ourselves, because till then the juniors are also trained, so they do all the basic things. So yeah, it is a very good branch, challenging branch for a perfect work-life balance. So, but I just completed, and I was just joined as a senior resident at the Metro Group of Hospitals. I've just completed 1 month. So here also I have a fixed timings from 9 to 7. So after 7 also I get 2 to 3 hours for myself. So also work is balance, life is balance, and in 2 to 3 hours I can do things of my choice or something. And also I love the branch, so it is quite challenging. Every day we have new patients, new procedures, new challenges. So I think this branch is for someone who loves to do different challenges every day, and also along with the monetary aspects, plus a good work life balance.
So, what is the future of growth of pulmonary medicine as a branch in the upcoming years? And also, sir, I would like to know about any such fear of being overtaken by other branches. Like there are many branches which are definitely threatened by other branches. Sir, is there any such fear of pulmonary medicine being overcome? And also, sir, any fear of being taken over by
Yeah,
artificial intelligence in
the
the
fear
future?
is most of the yeah the fear is most of the physicians used to treat basic pneumonia asthma patients, but in the long run, due to even medical legal aspects and interventions are a thing which are performed only by skilled and expertise pulmonologists. They can't be done by any physicians or something. So intervention is a branch in which it has a tremendous of growth. So in intervention, you can do basic bronchoscopies, transbronchial lung biopsies, thoracoscopies, navigation bronchoscopies, navigation robotic scopies, thoracoscopies, and a lot and a much more. So I don't think it will be ever be acquired by any other physicians or something. And intervention itself, in the aspects of monitoring, it has a lot of growth potential. Like one bronchoscopy is around, it is a first 5 to 10 minutes procedure, so charges is around 15,000 to 20,000. So yeah, it is a very good intervention is a very good thing to do in the long term. Apart from this, basic patients like COPD, asthma, they are initially measured by like physicians, but when the cases worsens, they definitely have to refer to a pulmonologist, because they can't manage it up to a certain point of time, but after that they definitely have to send to a specialist. So I don't think that it will ever be skilled. Secondly, you talked about artificial intelligence. We are using artificial intelligence. Many studies have been using artificial intelligence in the surgeries, minor surgeries, and navigation bronchoscopies. So we are using technical aspects to cure the patients. So yeah, it is a very demanding and a very growth potential field overall in the long term and in the next few decades.
So that means it is a very safe branch to take up.
Very safe option, definitely.
So, what are the super specializations and fellowships that one can do after finishing their MD in pulmonary medicine?
Yeah. So after finishing an MD in pulmonary medicine, you can do DM cardiology, DM pulmonology, or DM critical medicine. So these are the three DMs you can do after the pulmonary medicine. Secondly, fellowships, as I mentioned earlier, that you can do a fellowship in allergy medicine, you can do a fellowship in interventions, you can do fellowships in sleep medicine, you can do fellowships in critical care medicine. So there are a variety of aspects in which you can also do a fellowships and you can acquire the skill and then leverage it.
Okay, sir. So now, since counseling is round the corner, so I would like to ask you about the points that one must keep in mind before selecting a college for doing MD in pulmonary medicine. So I'm sure people would want to know about it also.
According to me, like what I did is I went around my rack. I know that I was getting from this 4 to 5 colleges. So I personally went to all the colleges. I see each and every department. I saw the OPDs, I saw the IPDs, I saw the number of patients admitted every day, I saw the number of procedures done, I see how the mentors are. I also saw the ICU setups in the ICU setups, how many beds are there. So, and also the OPD based procedures like spirometry, impulse oscillometry. These are the OPD based procedures. So, I think that rather going to a government setup, if you choose a setup in which you can learn variety of skills, because 3 years is a very long period of time. So if you choose a setup in which you can acquire the skills, so I think that they should do the similar thing like I did, because it has helped me in a, like after the MD. Now I feel that what thing I did at that point, it really mattered to me a lot.
Okay, sir. So now, at the end, any special message from your side guiding students who are going to take up pulmonary
Yeah,
medicine?
yeah, I believe that pulmonary medicine, it is the next in the next decade. It has a really a very good growth potential. It has a variety of aspects and a variety of like we talked about artificial intelligence and a variety of navigations. So I believe that specifically the interventional part, it has a lot of growth potential. Also critical care, allergy and sleep, they are also bread and butter. But I personally believe that interventional pulmonology, and it is also a thing which differentiates a true pulmonologist from other physicians. It has a tremendous growth potential, and it won't be acquired by another specialties. So, MD pulmonary medicine, it is definitely a go branch.
Okay, sir. So, thank you so much for taking out your precious time for our students and guiding us for all this. So, thank you so much. This means a lot, sir,
Thank you,
honestly.
thank you. And also, I thank your entire KYC for holding such sessions and helping the new doctors guidance, and they give guidance in a very good manner. So yeah, good luck to you all.
Thank you, sir. Thank you so much, sir.